Good evening, students. Once again, welcome back to our channel Ach'z. So today, 26th of July 2025, we had OET exam. Comparatively with other test dates, very few students only given the test today. That's per the global census I'm saying. That is because of the updation happening in the case of migrants, the rule of European countries and all. They reduce the workforce. Maybe because of that, the visa processing, the PR works, everything is getting delayed. Maybe I think most of the students are waiting for the next update to give the test, or they are preparing well for the upcoming exams and all. Anyway, we just collected the question booklet from different time zone. We got three different set of question booklet. And as I always mention, if you got any other question booklet or you are remembering the topic in the sense, try to comment that. Okay, and mention the test center also, then it will be easy. Okay, now we will start from the writing module first. According to our ultimate guide only, monthly basis we are releasing the preparation guide for the test dates. If you watch that, means I hope you all attended well. It's completely based on our preparation guide only. We just recommended you to prepare with two different type of question for the day, referral letter and transfer letter. The category is same. In two different centers, they reported referral letter, and in one center, transfer letter. So let's go in detail about the letter, the topic, everything. In the first letter, the patient details, marital status, occupation, DOB and all. The present complaint is recurring headache for the past 8 months. They just given the frequency, the duration, the location, the trigger factors, and also the associated symptoms like nausea, photophobia and all. And in the medical history, they just mentioned no allergies and there is mild depression given the date and all. Then in the management, advised to maintain the headache dietary, prescribed the medication for the partial relief, and tried paracetamol, that is ineffective, lifestyle advice given, and referred for psychological counseling, and he attended 2 to 3 sections. And here they just given the reason for the referral: increasing headache frequently and poor response to the current treatment. So needs neurologist assessment and long-term management options. So you need to write a letter to the neurologist in the city hospital. They just given the address of that and all for the evaluation and management of chronic migraine. So that's about the first set of letter. Coming towards the second set of letter, and before that, if you need the sample answer for these letters, means try to comment about that. We will publish that in the community tab. If you are a regular follower, means you will get the notification. Now about the second letter. So here you need to write a referral letter to the vascular specialist for the assessment and the further management of chronic non-healing leg ulcer in a diabetic patient. Here also they just given the details, personal details of the patient. In the medical history, they mentioned type 2 DM from last 20 years, hypertension last 10 years, peripheral neuropathy, and the patient is a chronic smoker. And to the current problem, they mentioned chronic ulcer on left lower leg, then presenting for 5 weeks, initially small cut, developed into larger ulcer. They just given the size of that. There is no any systematic infection signs and all, and they just given the HbA1c level, about the blood sugar, that is poorly controlled. Dressing changed regularly, antibiotic is prescribed, and there is no any significant healing. So the reason for the referral is ulcer not responding to the conventional treatment modes. So need vascular evaluation, possible Doppler studies, and also advanced wound care. So you need to write a letter to the vascular specialist. And to the third set of letter, that's a transfer letter. So here the patient need to transfer for the post-operative wound care and rehabilitation. Again, they just given the patient details, the admission reason and all, like the total hip replacement, admission date, surgery date. And in the medical history, they just mentioned about osteoarthritis, hypertension, that is controlled, about allergies to the penicillin. Then post-operative progress like mobilizing with physiotherapist, pain well controlled with paracetamol, and given the details about the surgical wound care, healing, star plates to be removed in 5 days, and requires the daily dressing or physiotherapy exercises about the fall prevention. So they just given a lot of information. You just want to make your letter more concise. And now the reason for the transfer is ready for discharge from acute care, needs ongoing rehab and nursing support for wound and mobility care. So that's about the 3 different set of letters from today's exam. Now we will discuss about the next module, reading section. In the first set of reading, part A, the topic was sepsis, and the test A including definition and pathophysiology of sepsis. They just provided the overview of the sepsis, how it developed, about the systematic response of infection and all. Then test B about signs, symptoms and the diagnostic criteria. Test C about the initial management and also about the treatment protocol. And the test D, nursing consideration and monitoring requirements. And coming towards the C1 and C2, standard operating procedures for this catheter insertion and also emotional toll of nursing in a pandemic situation. So that's about the C1 and C2. Now coming towards the second set of reading, the part A, the topic stroke, and in that the test A including the types and causes of stroke. They just explained about this ischemic hemorrhagic stroke including the common risk factors and all. Test B about the clinical presentation and early warning signs. Then test C, emergency treatment and about the thrombolysis, which means the guidelines. Then the test D about rehabilitation and long-term management. And in that C1 and C2 including new equipment handling and also about this nurses and the end of life decision making. Now coming towards the third set of reading, part A topic ASD, autism spectrum disorder. Test A including the overview and the diagnostic criteria of ASD like the DSM-5 early detection signs and all. Then test B, communication and behavioral characteristics. Then test C about support strategies and educational interventions, which means they discussed about the therapies like ABA, classroom support, family education and all. And test D, role of healthcare professional in ASD management. So they just outlined the role of nurses or the pediatrician, psychologist, the support workers and all. In that the C1 and C2 including the memo about the shift handover and also about this the nurses burnout. So that's about the 3 different set of reading passages or the question booklet. Now we will discuss about the next module, listening. In that the part A, in the first set, they talk by a GP and patient about the urinary tract infection. Part B including the conversation between this ward manager and nurse about revising infection control policy, and the emergency department doctor giving the update on this triage prioritization. And there is a team briefing on this new protocol for the sepsis screening. And the C part, it was a senior nurse discussing effective pain management strategies in the post-op care. And another one about the interview with a clinical psychologist about managing mental health issues in long-term hospital patients. So what all things the students remember, they will share that. So anything more means you can also comment over that. Anyway, in the listening set 2, in the part A, it was a talk between neurologist to a female patient, migraine and vision disturbance. And in the same part, the second extract, it was a talk by a practice nurse to a patient with the diabetic foot about the ulcer management and all. And in the B part, the topics like new documentation guidelines, then senior nurse explaining how to use the early warning score system, then briefing by the infection control officer on isolation procedure and all. And the C part, that long presentation One is about the geriatric nurse giving talk about this fall prevention in elderly patient. And the second extract, again, it was an interview with a respiratory specialist about the COVID and the rehabilitation strategies. So, and the third set of listening. In the part A, the first extract was a nurse conducting a wound care review, and it was a talk like community nurse and a middle-aged person. And extract 2, it was a talk between emergency physician and a female patient. And in the part B, that workplace related short extract, the topics which we got, that is midwife explaining about this neonatal resuscitation, and another one is about this manual handling procedure. And the C part, one is about the seminar on this nutrition in wound healing, like the dietitian is talking over. And the second extract is like the nurse researcher. They just given the topic like the role of evidence-based practice in nursing. So these all are the listening topic. I think today we got little bit more explanation in the listening module. Usually students are not remembering these all factors after the exams. Yeah, anyway, today we got a little more content. Anyway, thank you for sharing the review, those who called and messaged. And as I always mention, if you got any other topic means, try to mention that clearly in the comment box. Now coming towards the last module, speaking section. Again, we got 6 different role play card. First is post-surgery pain management. The setting is hospital ward. The patient, they just given the details of the patient complaining of the pain. So you need to ask about the type, location, severity of the pain and all. And explain that the pain after surgery is very common and can be managed. You need to discuss about this pain relief options like oral analgesics, or about the side effects, the timing, everything you need to explain. And you need to encourage the patient to report if the pain worsen. And you need to reassure and advise about the mobility and also about this deep breathing exercise to avoid the complications. Then the second role play card scenario, the setting is outpatient clinic. The patient recently discharged with indwelling urinary catheter. I think these all topics we discussed in the guide. You can just cross check, okay? And your task is to explain the basic care and hygiene for this catheter. And you need to advise on the signs of this infection. And you need to instruct about how to handle this drainage bag, about securing or emptying, and reassure about this temporary use and when it will be reviewed, that means when it will be removed. And you need to encourage the patient to ask if there is any questions. Now coming towards the third role play card, the setting is emergency department. You are talking to a patient who had an asthma, okay, asthma flare up. They just given the detail, and the task is to, you need to ask about the asthma history, the trigger factors like the cold or dust and all. Then you need to explain the importance of regular use of this inhaler to avoid these triggers. And you need to clarify how to use this reliever or this inhaler properly. You need to discuss the asthma action plan, when to seek the urgent care, or about this follow-up with the GP. And to the next one, very common card, diabetic patient. The setting is community health center this time. You need to explain the importance of this diet, exercise and the blood sugar monitoring. You need to teach how to use this glucometer and how to keep the records. Discuss the possible symptoms of this hypo or hypoglycemia. And you need to talk about the food care and also about this eye checkup and all, and reassure the patient and encourage for this regular checkup. The fifth one, the setting is postnatal ward. The patient is new mother. You need to ask how she is feeling physically and emotionally. You need to provide this breastfeeding support about the positioning, frequency and all. You need to explain the normal post-birth changes like the bleeding or cramping, tiredness. Reassure about this newborn behavior. Then you need to encourage this rest and bonding, okay, and offer all the support. And the last role play card scenario is setting is pediatric ward. the child with fever. Again, one of the common card we can see. You need to reassure the parent and explain that fever is very common based on the climatic condition and the because of the low immunity level. You need to discuss monitoring temperature, hydration, the activity level and all. And you need to explain about the medication use, normally paracetamol and ibuprofen, and inform about these red flags, and you need to advise the follow-up kid what to expect in the next 24 to 48 hours. So that's about the role play card scenarios. I hope I explained it well. Today actually we got little more explanation comparatively with other test dates. I like to give in like that only. Anyway, if you need any samples means try to comment over that. We will publish that in the community tab. Okay. You can just check out where we are posting the updates and all now about the video release or all the notifications. So you can just cross check the community tab to get to the sample. If you are asking only, I will publish, okay, or else I will not do that. Anyway, I hope you all attended well and all the very best for your upcoming exams. Next exam, so we will release the preparation guide for the day as soon as possible. So try to prepare according to the guide, then it will be helpful during the exam. So all the very best again. Hope you all will get good results and God bless you all.